This is the news on NTA International, and I am Lami Ali with the headlines. Sharing news as Lagos State Government announces discharge of more patients from Mainland Hospital, Lagos. The state government to prepare 300-bed capacity to be used as isolation centers in Nigeria. Federal Ministry of Agriculture releases 70,000 metric tons of grains to Nigerians. Many thanks for joining us. The federal government is working with other stakeholders to institute medical and life insurance cover for the protection of frontline health workers engaged in the fight against COVID-19. Chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa, announced this at today's briefing in Abuja. Mitai Rekbeng has the report.
As the Presidential Task Force on COVID-19 coordinates the national strategy to contain the pandemic, it is not forgetting the sacrifices of essential workers who put their lives on the line to safeguard the health of the nation.
Government is working with other stakeholders to structure medical and life insurance cover for their protection. I therefore wish to assure them of our commitment and urge them to put in their utmost best as they battle to save us from this ravaging virus.
Law enforcement agents were warned by the task force to be humane in enforcing restrictions in affected lockdown states.
The message from Mr. President is that no Nigerian should, on account of these rules, suffer any harm or pains during this period.
With the projection that COVID-19 cases in the country will increase, the nation's health sector managers are not leaving anything to chance.
We are already seeing what may be indications of sustained community transmission in the sense that 30% of the cases have incomplete epidemiological information.
We have added one more lab this morning over the last few days, so we now have 8. Between Sunday and Monday, we hope to activate Kano and from there start a series of labs in the northern part of Nigeria to make sure everyone has access to the lab closest to his or her location.
All radio stations and television stations should not entertain any unverified claim as to vaccines or drugs or treatment for COVID-19. And anyone that does so will be fined.
Our permanent representative in Vienna, Austria, has been able to obtain from the International Atomic Energy Agency, one of the agencies of the United Nations, about 80,000 euros worth of medical equipment and supplies.
Regarding oil and gas exemption for flights, mostly of which are helicopters and a few fixed-wing aircraft, they will continue to do so. However, they will be restricted to only oil and gas services.
While the 2-week lockdown continues in Lagos, Ogun, and the Federal Capital Territory, traders and business owners were advised not to exploit fellow Nigerians by hiking prices of commodities. In Abuja, Mitai Rekbeng, NTA News.
And from Lagos State comes the cheering news that 4 more COVID-19 patients have fully recovered and also discharged as the battle against the dreaded virus disease intensifies in Lagos. Nosa Osula, who was at a briefing by the State Commissioner for Health, Professor Akin Abayomi, reports that this brings the total number of recovered persons to 24.
Governor Babajide Sanwo-Olu, who is the incident commander in the state, had in a statement on the update on coronavirus in Lagos disclosed release of 11 more patients from the state's facility in Yaba on Thursday. According to the Commissioner for Health, a total of 98 cases are in Lagos, Etiosa with 47 cases, Ikeja 24, Lagos Mainland 11, and Agege, Alimosho and Ikorodu with 1 each. The commissioner added that the primary objective of government is to flatten the curve, and the ministry, in collaboration with relevant stakeholders, are doing everything possible to ensure that they reduce the way people are infected.
At the moment, most of our patients have had mild disease, some bordering on moderate. We have had no deaths, and our patients seem to be profiling well.
Professor Abayomi added that training is ongoing for medical health care workers to increase the workforce and improve service delivery, adding that the ministry is doing contact tracing for about 2,450 persons that had contact with confirmed coronavirus patients in the state.
We have 5 ventilators in Yaba. We have another 10 in Oniko. We have about 6 at Lasuth.
Every statement that we have issued, we have told the public that they should mind and be wary of any information they get on the social media.
Commissioner for Information and Strategy, Gbenga Omotosho, also urged residents to maintain high personal hygiene and practice social distancing. In Lagos, Nusa Usula, NTA News.
And in the meantime, Nigeria's Center for Disease Control has announced 6 new cases of COVID-19 in Osun State, Nigeria, as at 11 in the morning, 3rd of April, bringing the number of confirmed cases of COVID-19 reported in Nigeria to 190, while 24 have been discharged and 2 deaths recorded. Meanwhile, the global coronavirus cases have surpassed 1 million, with more than 52,000 deaths as the pandemic further exploded in the United States and the death toll climbed in Spain and Italy. Italy had the most deaths, more than 13,900, followed by Spain. The United States had the most confirmed cases of any country, more than 240,000, the data showed. Since the virus was first recorded in China last year, the pandemic has spread around the world, prompting governments to close businesses, ground airlines and borders, while hundreds of millions of people were ordered to stay at home to try to curb the spread of the virus. And more than 1 million cases of coronavirus have been recorded globally, a new grim record as the world grapples with the spreading pandemic. Joyce Umetu gives us the latest COVID-19 developments on the global scene.
The number of confirmed COVID-19 cases worldwide has risen above 1 million, doubling the total in the past week. The tally showed that a total of 1,044,167 people have been diagnosed with the virus across the world, with a death toll of 55,311, while recoveries stand at 222,332. The United States has the world's highest number of cases, with nearly 250,000 confirmed infections. Half of the country's deaths have been in New York. The U.S. recorded 1,169 coronavirus-related deaths in just 24 hours. That represents a new biggest daily death toll in any country since the outbreak began. In Europe, Spain has overtaken Italy in its total number of confirmed cases, meaning it is now fighting the second biggest outbreak in the world. The latest figure shows that the country now has 117,710 infections. 932 people have died over the past 24 hours. The death toll is still behind Italy, which has recorded 13,915, while France has recorded 5,387 more. And in the United Kingdom, the number of confirmed coronavirus cases is also on the rise, with nearly 38,168 now testing positive across the country. 3,605 people have died and 135 have recovered. The number of deaths in Germany has risen to more than 1,000. It now has more cases than China, according to figures from Johns Hopkins University. In the meantime, Iran, the country most affected in the Middle East, has seen its death toll rise to 3,294 as it claimed 134 lives in the past 24 hours. The total number of people infected is 53,183. In Africa, the outbreak appears to have reached almost every nation on the continent of 1.2 billion people. As at Friday, 6 p.m. local time, the Africa Center for Disease Control reported 7,028 cases of the virus, 284 deaths, and 561 recoveries. Meanwhile, Malawi has reported its first 3 confirmed cases of coronavirus. The Southern African nation was among the few African countries yet to report any case. This means that there are just 4 countries left without a confirmed case on the continent. While an update from South Africa, the country with the highest cases on the continent, says more than 47,000 people have been tested and 67 mobile testing units have been organized. To date, only 5 deaths from the virus have been confirmed. About 1,400 have been tested positive for COVID-19. In other developments, UK Health Secretary Matt Hancock set a goal of 100,000 tests in England per day by the end of the month, while authorities in New York and Los Angeles have advised people to wear a face covering in public to prevent further spread of the virus. Meanwhile, the World Bank has launched a $1.9 billion emergency fund to help 25 countries deal with the outbreak. And French police are stepping up checks to prevent people leaving Paris for Easter to stop the spread of the virus, and those who break the rules would be fined. And that's a global update on COVID-19. Thanks for staying. I am Joyce Umetu.
Meanwhile, the American government has evacuated first batch of our citizens residing in Nigeria through the Murtala Muhammed International Airport, Lagos, by chartered flights.
The repatriation is voluntary. The criterion is for Americans willing to take advantage of the special flights back home to sign promissory notes to pay for their tickets when they reach their country, if the immediate fund for the journey is not available.
This is something that we do all over the world in times of emergency. The U.S. government helps them get to a central location, oftentimes in Washington, D.C., and then the individual makes arrangements to get to their home.
I just thank God that this is happening, and that's complimentary for the United States of America, evacuating their citizens in such a time.
It was a good idea.
We've been here for a while, and we were stuck. But I thank the United States for coming to our aid.
The screening was intense, and the various personnel at the international wing of the Murtala Muhammed Airport were fully on ground to ensure smooth exercise.
We've gotten approvals from the federal government. They send down the approval to us. We cannot turn it down. We have to allow them to evacuate their citizens.
The U.S. mission says citizens abroad should register and monitor the relevant website to receive up-to-date information. In Lagos, Adeola Komi Akere, NTA News.
Still on COVID-19, sequel to requests by Nigerians stranded abroad in the wake of the coronavirus pandemic, the Ministry of Foreign Affairs has directed all its missions abroad to compile lists of willing nationals who want to come back home. The interested Nigerians are advised to inform the missions in their various countries they are in, who will then collate and coordinate with the Ministry of Foreign Affairs in her Twitter handle. Chairman, Nigerians in Diaspora Commission, Abike Dabire-Rewa, said the Ministry of Foreign Affairs has instructed that the financial implications will be borne by the prospective evacuees, who will be compulsorily quarantined when they return. They urge Nigerians stranded abroad willing to return home to key into this federal government's gesture by providing their information to the mission in their respective host countries. She noted that while embassies in several countries are also on lockdown, those interested could also go online and fill a form provided on the Commission's website. This is the news reaching you from our studios here on NTA International from Abuja, Nigeria's capital city. More reports after this break.
Now believe this Koroti. You know, if you touch black man, if you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give him?
Give me 200. Take your change now. You don't want your change.
My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so e no get leg. Now we dey waka kurukere. No waka around, make the virus for die. No forget, say, the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
NTA International News. Africa as it is.
Thank you for joining us again. To provide us with more information on coronavirus, especially as it affects women and children, we have an expert here with us in the studio, Mrs. Comfort Maduka, who is going to give us an insight. Ma'am, thank you for joining us on the program.
Thank you.
Now, women and youths are often the most vulnerable in circumstances of this nature. What additional measure and care are they being provided in the fight against the coronavirus pandemic?
Actually, we have taken our sensitization programs to the indigent people in IDP camps within and around Nigeria, because we discussed and discovered that there are a set of people that may not have access to good information concerning this coronavirus. So we took the message down to their camps, sensitized them, and made available to them some preventive materials like hand sanitizers, face masks, and this washing hand basin with soap. And we taught them how to apply them so that they can stay safe from the spread of this coronavirus and from contacting the coronavirus.
Now, you've done a lot of sensitization and distributed also some items to help in keeping people, ensuring personal hygiene. And as we mentioned earlier in the program, you deal more with women and children. What tips, additional tips on hygiene practices do you have for mothers and the youth at this crucial time?
Truly, I have to advise mothers who are more or less the caregivers to the homes, because the fathers may not have that time to stay within and around homes from morning till night. So it is the mothers that have the sole responsibility to guide their children on these tips. Wash your hands as regularly as possible with soap and on a running water. Stay away from crowded environments. Then use your face mask and your hand sanitizers in a place that you don't have access to running waters. Thank you.
We thank you very much for that information. That was Comfort Maduka, an expert on issues concerning women, youth and children. Moving on now, the Federal Ministry of Agriculture and Rural Development has commenced the process of releasing 70,000 metric tons of grains and other food items as directed by President Muhammadu Buhari. Minister of Agriculture and Rural Development, in an exclusive interview with our agriculture correspondent Musa Baba Aliu, says the food items will be released from 7 centers across the country.
The 70,000 metric tons of grains are to be released from 7 centers across the country. The locations are Mina in Niger State, Lafia in Nasarawa State, Dusema in Katsina State, Yola in Adamawa State, Gusau in Zamfara State, and Ilesha in Osun State. The Minister of Agriculture and Rural Development, Muhammad Sabananono, said all the food items are in good condition and ready for handing over to the National Emergency Management Agency.
As far as we are concerned, we are prepared to carry the President's directive, and we believe that by next week we'll be in a position to hand over to NEMA. From there they take off. For grains such as maize, sorghum, we have to treat it and wash it and bag it.
The ministry, being a member of the Presidential Task Force on COVID-19, said the mechanism have been put in place towards ensuring that the food items are not diverted.
What we advise NEMA in our various meetings is that they should also seek to work with other stakeholders down the line, especially the state governments and the state emergency management agencies, to ensure that the vulnerable are properly identified and that there are no diversions. We have also advised them to get the security agencies.
We have a standard lab that will carry out analysis, and this has been done to ensure that the food is safe for consumption. And in doing so, in the course of release, we have an automated system, the cleaning system, that will ensure that all debris associated with the grains are properly removed and the grain well cleaned, bagged for consumption.
Of the 70,000 metric tons, 5,000 metric tons of cassava flakes, popularly known as gari, are ready for immediate release, while the grains are to be bagged before evacuation. In Abuja, Musa Baba Aliyu, NTA News.
In the meantime, the FCT Minister of State, Ramatu Tijani Aliyu, has called on residents to ignore the rumors making the round on social media platforms claiming that over 100 patients of coronavirus are in Kubwa General Hospital receiving treatments. The minister, who made this call on a fact-finding mission to the hospital management, described the rumor as fake news. Ifeanyi Ezumba reports.
Emphasizing that it is a rumor taken to an extreme point, especially at this critical period, the FCT Minister of State, Ramatu Tijani Aliyu, stated that there are designated isolation centers where asymptomatic patients are kept in different parts of the territory, adding that her visit was not just fact-finding mission, but to restore confidence in the minds of the people.
We know that with your knowledge of what it is and the virology, that you will also not keep the COVID-19 patients in this facility.
No such thing in Kubwa General Hospital. We have never relayed such information to anybody or to the public at any time by any person or any officer of this institution.
In a related development, the FCT Minister of State also visited the Kubwa market in Abuja. Ifeanyi Ezumba.
To security issues now, President Muhammadu Buhari has directed the Nigerian army to join the police and flush out bandits from forests around the country, particularly in the areas that witnessed recent attacks. The president gave the directive in response to the killings of 22 people in Sokoto State, whose community was attacked by armed bandits, as well as the reported killing of 10 others in Bassa local government area of Plateau State. In a quick response, the Chief of Army Staff, Lieutenant General Tukur Buratai, has already gotten in touch with the general officers commanding the army formations in the affected states to reinforce the police efforts to tracking the bandits and bringing them to justice. In a statement by the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, President Buhari commiserated with the governments and people of the two states, assuring Governors Aminu Tambuwal and Simon Lalong of federal government support in bringing to an end the spate of attacks in the regions. The Nigerian Armed Forces has scaled up the production of liquefied oxygen, a critical component for the treatment of COVID-19 patients. The coordinator, Defense Media Operation, Defense Headquarters, Major General John Enanche, stated this at a media conference in Abuja. Defense correspondent Ismail Musa has the report.
Globally, the military is known for supporting the civil society during trying moments like the current coronavirus pandemic. To this end, the military is training 80 active medical personnel as it increases the production of liquefied oxygen gas at the 103 Strike Group, Nigerian Air Force Base, Yola.
The liquefied oxygen is being gasified and will be stored in cylinders for immediate supply to isolation centers and designated hospitals as will be directed.
On update of armed forces operations across the country, the coordinator notes that troops of the Multinational Joint Task Force are conducting offensive clearance alongside their counterparts under Operation Lafia Dole. He explained that a joint operations by the land component of Operation Lafia Dole led to the freedom of 10 kidnapped victims by Boko Haram around Goza and Pulka in Borno State. Similarly, troops of Operation Awase intercepted a group of pipeline vandals in Ogun State.
On sighting the troops, the pipeline vandals and truck drivers fled, abandoning hoses as well as 8 trucks of 33,000 liters capacity each and a Toyota saloon car at the site.
The defense headquarters appealed to the public to provide credible information to enhance rapid response. In Abuja, Ismail Musa, NTA News.
Time now for a peek into the world of sports. Sports personalities called on athletes to stay safe. Tamara Ibiwe brings us these and sports updates.